Welcome back. In this video, we'll focus on crisis management, specifically how to handle a depressive crisis in a non-specialized setting. Depression can sometimes escalate to a crisis point, where the individual's symptoms become overwhelming and immediate intervention is needed. Whether you're a general practitioner, a community health worker, or another non-specialized health provider, it's important to know how to manage a depressive crisis when it arises. Let's begin by understanding what a depressive crisis looks like. A depressive crisis occurs when a person's depression symptoms intensify to a point where they become overwhelming. During a crisis, the individual may experience extreme emotional pain, hopelessness, and despair, which can lead them to feel that they cannot cope with their situation. In some cases, this can escalate to suicidal thoughts or self-harm. Symptoms of a depressive crisis may include severe emotional distress, feeling completely overwhelmed, hopeless, and disconnected from reality. Suicidal thoughts. A person may express thoughts like, "I don't want to live anymore," or "everyone would be better off without me." Impaired judgment. The individual may be unable to make rational decisions or even function in daily life. Self-harm or suicidal behavior. The person may act on thoughts of self-harm or may have a clear plan to hurt themselves. A depressive crisis can occur suddenly or build over time, so recognizing the signs early is essential in preventing harm and providing the right support. Step 1. Immediate assessment of risk. When a depressive crisis occurs, the first step is to assess the level of risk. This means determining whether the individual is at risk of self-harm or suicide. If someone is actively talking about or showing signs of suicidal intent, immediate intervention is necessary. To assess the level of risk, you can ask direct and non-judgmental questions such as, "Are you thinking about harming yourself? Have you made any plans to hurt yourself? Do you have access to means, like medication or sharp objects, that could be used to harm yourself?" It's crucial to ask these questions in a calm and supportive manner to make the individual feel safe enough to share their thoughts. If the person is expressing suicidal ideation, it's important to take immediate action. Step 2. Ensure immediate safety. If the individual is at immediate risk of self-harm or suicide, ensuring their safety is the top priority. In a non-specialized setting, this might involve removing any harmful objects from the immediate area, such as sharp objects, medications, or weapons. Supervising the individual closely until help can be provided. If necessary, arrange for urgent referral to a mental health professional or emergency services. It's important to make sure that the person is not left alone during this critical time. Step 3. Provide emotional support and validation. Even if the individual isn't at immediate risk of self-harm, a depressive crisis can cause extreme emotional pain. Providing emotional support and validation can help alleviate some of the distress. In these situations, it's important to listen actively to what the person is saying. Offer compassionate reassurance. Let them know that you understand their pain and that help is available. Avoid minimizing their feelings. Instead of saying things like, "You'll get over it," or "Just think positive," it's more helpful to say, "I'm really sorry you're feeling this way. You don't have to go through this alone. We'll find a way to help you." Sometimes, just knowing that someone is there to listen can help reduce the immediate sense of hopelessness. Step 4. Involve appropriate support. Once immediate safety has been addressed and emotional support has been provided, it's important to involve appropriate support. For someone in a depressive crisis, this may involve referring them to a mental health specialist for further assessment and treatment. This could be a therapist, psychologist, or psychiatrist. Connecting the individual with a crisis hotline or 24/7 mental health support, which can provide immediate assistance if they need help in between appointments. If necessary, arrange for hospitalization if the individual is at high risk of harm and cannot be safely managed in an outpatient setting. It's also important to involve family members or close friends who can help with emotional support and ensure the individual has a network to rely on. Step 5. Follow-up and ongoing support. A depressive crisis doesn't end after the immediate situation is stabilized. Follow-up care is crucial in ensuring that the individual receives continued support and doesn't fall into another crisis. During follow-up appointments, the healthcare provider should assess the individual's mental health. Is the depression improving? Are suicidal thoughts still present? Are there new stressors contributing to their condition? Review the treatment plan. Ensure that the individual is adhering to any medications and therapies and that side effects are being managed. Provide additional resources, such as therapy, support groups, and self-care strategies. Additionally, it's essential to monitor family dynamics if family conflict is contributing to the individual's depression. Involving family therapy can often be a helpful step in resolving these ongoing issues. Reflection questions. How do you assess the level of suicide risk in a patient during a depressive crisis? Why is it important to ensure safety and not leave a person with suicidal thoughts alone? In summary, managing a depressive crisis in a non-specialized setting requires a combination of immediate assessment, ensuring safety, providing emotional support, and involving the right resources. By addressing these key areas, you can help reduce the risk of harm and connect individuals with the mental health care they need. As we move forward, we'll explore how to implement practical case-based projects and problem-solving therapy exercises to continue building skills for managing depression effectively in various settings. Let's keep it going, and I'll see you in the next one.